thumb and pinky together. I'm going to try to pull apart and resist. Alright, it's a grade 4. So you can also see right here there's a dimple where the lunate is subluxated. So I'm going to start with the scaphoid, and it's going to go anterior lateral. And then I'm going to move over to the triquetrum, and it's going to go anterior medial. And then I'm going to move to the lunate, and I'm going to drive posterior. And now I'm going to do the distal radius and ulna. I'm going to squeeze and distract. And then I'm going to do the thumb. My line of drive is going to be medial. And then the proximal row of carpal spread, my fingers are going to push A to P, and my dinars are going to be lateral to medial. And now I'm going to do a distal row distraction, so trapezoid, capitate, lateral hamate, hamate. And go ahead and put your thumb and pinky back together. And it's a grade 5. For Sherrod's elbow protocol, we are going to start with the radius. I'm going to bring the wrist into pronation and supination and feel for an abrupt stop, and there's springiness on supination. And so I'm going to come over here. I'm going to activate the Mogawat of 3. I'm going to bring the wrist into full supination, and I am going to contact the radial head and go P to A, lateral to medial. And we're going to check again for an abrupt stop, and there is an abrupt stop. So for the elbow, I'm going to come to the medial epicondyle.
Oh, ow.
And there's pain with that, so that's an indicator to adjust the ulna. And so I'm going to cross-fiber the wrist flexors, and I'm going to set up on the olecranon, and I'm going to thrust P to A. And I'm not going to double check that pain because it's chemically mediated. So now I'm going to do the alternative elbow adjustment, and I'm going to start by making sure the spine is clear by checking the triceps. Resist. And it's a grade 5, so now I'm going to move to the ulna test. And it's a grade 4, so I'm going to start with the most common subluxation, which is posterior medial. And I'm going to contact it with the first MCP joint. And so I'm going to come over here and thrust anterior lateral. I'm going to retest, and it's still weak, so I'm going to come over here, so that means that it probably subluxated posterior lateral, and I'm going to come in and contact again and thrust posterior or anterior medial. I'm going to retest it one more time, and it's strong. So I've already cleared out the triceps, and so now I'm going to do the radius test. And so that's a grade 4, and so now I'm going to do brachioradialis, and that's a grade 5 strong. So now I'm going to come over here, and I'm going to do a posterior lateral radial head adjustment. So I'm going to bring the hand in full pronation, and I'm going to drive anterior medial. The thumb's going to roll off. I'm going to come and recheck, and it's a grade 5 strong. So if it had been weak on the brachioradialis test, I'd come over here and do an anterior medial subluxation, and so I would be thrusting posterior lateral, and then I would come and recheck, and it would be strong. So now we're going to go ahead and do the Sherrod's protocol for the shoulder. We're going to start with a muscle test, try to resist, and it's a grade 4 or less. So we'll go ahead and do the wrist extension technique. We're going to come in the deltopectoral groove, and my pressure hand is going to be 15 pounds, and my speeder hand is going to be 10 pounds. Alright, and so now we're going to go ahead and recheck, and it's a grade. Alright, so we're going to start with the alternative supine adjustment, and the muscle test that I'm going to do is the same muscle test I will do for the next 2 adjustments, so in theory I would do it before and after both of these next 2 adjustments. But for the purpose of this video, it will only be before and after the first adjustment. Alright, so go ahead and resist, and it's a grade 4 or below, and so I'm going to come in here. Alright, and shoulder is off the table, and I'm going to come in and thrust A to P. And then I am going to recheck. And it's a grade 5 strong. So this next one is going to be the seated alternative adjustment. Go ahead and sit up. Alright. So I'm going to come around. I'm going to thrust A to P. Okay. And so like I said, in theory, before and after, I would have done the muscle test. Alright, so this is going to be the AC joint for the superior distal clavicle. Alright, and I'm going to be checking for a springy feel, and there is, so I'm going to thrust inferior, and I'm going to recheck, and there is no more springy feel. Alright, so now I'm going to be palpating the SC joint, and I'm going to make sure there is individual movement. And I do not feel individual movement, so I'm going to contact the clavicle with my thenar. Go ahead and look toward my right elbow. I'm going to give him a few stretches. Okay. And now there is individual movement. Alright, so now we're going to do the trigger points, and I'm going to start with the subclavius muscle. And I'm also going to do the midscapular area at the same time. And then I'm going to move to the teres minor and major. Then I'm going to work on the levator. Then we're going to move to the lateral deltoid. And then I'm going to move to the medial humeral head. And then lastly, the subscapularis belly. Alright, so we're going to start with the scapulothoracic articulation. Alrighty, and so now we're going to check the inferior glide of the humeral head. So now there's springiness in it. And next we're going to move to the levator scapula tendon. So go ahead and shrug your shoulder out for me. Alright, you can relax. I'm just going to take my thumb and go around the scapula. Alright, so now I'm going to go ahead and assess the SC joint. First I'm going to start with the pec major muscle test. Alright, so I'm going to internally rotate the hand, push lateral and inferior, resist, and it's a grade 4 or less. So go ahead and lay on this side for me. I'm going to set up on the SC joint, and I'm going to hold his head right here. And it's going to be mainly a medial to lateral thrust. Alright, and go ahead and lay back on your back. One more time with the hand, internally rotate, and resist. And it's a grade 5 strong. So now I'm going to move to the AC joint, and I'm going to do the coracobrachialis test. Alright, go ahead and resist. And it's a grade 4 or below. So go ahead and sit up for me. Alright, and it's going to be a superior to inferior line of drive. Okay, go ahead and lay back down. Muscle test one more time. And it's a grade 5. Now we're going to assess an anterior humerus doing the teapot method. So go ahead and put your hand straight up. There you go. And resist. And that's a grade 4 or below. Go ahead and stand up for me. Put your hand on your hip. And then just go ahead and resist against me. Alrighty, go ahead and lay back down. Hand up. And resist. And that's a grade 5. So now we're going to do a posterior humerus assessment. Go ahead and flip over for me. Place the back of your hand in the small of your back. Lift your elbow as high as you can. And then I'm going to push down and just resist against it. Alright, so that's a grade 4 or below. So I'm going to internally rotate the arm and distract and push P to A. Go ahead and place your hand back. One more time, resist. And that's a grade 5.